Tylenol. Don't take it. With Tylenol, don't take Tylenol. Don't take it. With Tylenol, don't take it. Don't take it. Don't use Tylenol. Don't take Tylenol. Don't take Tylenol. Fight like hell not to take it. I think you shouldn't take it. Don't take Tylenol. The baby gets a shot. They say, here, take a cup of Tylenol. I've heard that for years. Take Tylenol. Don't take Tylenol. Don't have your baby take Tylenol. Don't give Tylenol to the baby. Don't give Tylenol to the baby. Don't give your baby Tylenol. Don't take Tylenol. Don't take Tylenol. Don't take Tylenol. Don't take it. Don't take it. So that's it. There's nothing much to say. Don't take Tylenol. Just don't take it. And I just say it again. Don't take Tylenol. Don't take it.
Good afternoon, everyone. My name is Michelle Kinney. Welcome to Over It. I'm here with the lovely Joanne Carducci, JoJoFromJerz, and Tara Setmayer. What you just saw was a supercut that the Jimmy Kimmel show put together last night of Donald Trump's very deranged press conference about Tylenol. And just to give a tip of the hat to Jimmy Kimmel for coming back on air last night, we wanted to play that because, quite frankly, if we do not laugh, we will cry. So, good afternoon, everyone. How's everybody doing?
I mean,
Hi.
It's been a week. It's been a week.
My Substack yesterday was about it being the darkest of times and the dumbest of times. Honestly, every day is like this smorgasbord of fucking shit that you're just like your head is spinning, but the laughter is really the only sort of
it's all we have.
Yeah. What do I always say? Laughter does good like medicine. It's a proverb. It's one of the good things in the Bible that we'll quote. Okay, not the Charlie Kirk type of interpretation of things in the Bible. Laughter does good like medicine, which I think is a good theme for our show today because we're going to talk about Jimmy Kimmel's return last night in a little bit because it was outstanding for those of us watch it. I actually had to watch it through my pirate way of watching things on the New York affiliate because in Washington it was preempted, but Jimmy was excellent. But we also wanted to talk about the absolute quackery that happened this week that kind of got a little bit overshadowed by the Kirk Memorial bullshit, and then what happened at the UN, and then like Trump was late on Monday to this big announcement. Like there's been a lot of medical quackery going on for the last couple of weeks, and the supercut that Michelle just showed, that Jimmy Kimmel showed last night, really sums it up. And I said, you know what? We need to bring our good friend, Dr. Vin Gupta, on. Many of you have probably seen him on NBC. He's the one of the medical commentators there on NBC and MSNBC. He's incredibly accomplished. He's an Air Force veteran. He's a pulmonologist, and he's an emergency, doctor. He's done like his credentials are outstanding. And I'm proud to call him a friend. And I said, you know what? There's a lot of people wondering. And for us over at Seneca, our national press secretary and social media director, Mallory Hagan, former Miss America, is pregnant. And so this is like personal for us too, because she's like, I can't tell you how many times I've had to like worry, did I do something wrong? Did I not? So this conversation about women and guilting women into doing something wrong that's causing autism for their kids, it's like a much bigger conversation. And even though Michelle and I don't have children, but Joe has, and it's like, we can still talk about this as women and all this medical that's going on, that we need to bring some expertise in because we're experts on life experience, but we're not medical experts, and we don't play one on TV like the dumbass president of the United States that we have. So we've got Vin now, I think. Yes. Dr. Gupta,
bring him in,
joining us. We're so thrilled. Vin, welcome back. I'm sorry it's under these circumstances, but we need you. We need you, my friend.
Thank you. Thank you. And, it's so good to be with the three of you, and I love joining you guys. So thank you. Even though I know whenever I get this feedback that whenever people see me, usually it's not under good circumstances. So there's that. But
hopefully there'll be some sort of medical breakthrough in the next few years, and we can have you back to celebrate some good news. But unfortunately, you're right. In the meantime, it's like no good. No
Well,
good. No
I
good.
don't. Joe, have you ever interviewed
No.
Dr. Gupta? So this is
No.
your first time. Oh,
yes, it is very nice to meet you, and it gives me so much
Pleasure.
hope that we still have experts
Oh,
in the
Yes.
world. Yes.
great to meet you too. I follow your great work on social.
Oh
Joe,
God, I'm
so,
sorry.
no,
You're like
it's
a
important.
legitimate person, and I'm I'm like a trash talking mom troll. But it's
no,
Not at all. Not at all.
so much
No,
more than
no.
that,
Thank you.
Joe.
Well, no, thank you again. I mean, truly, I just to say it for your audience and just to restate it to the three of you, I don't take for granted what it means to be, hopefully a trusted voice on all things health, especially now, and so I'm really grateful to be here.
And this is why we love you, and why it really is an honor and a privilege to have access to someone like you, so the caliber of what your career and your work and your trustworthiness. You were a trusted voice during COVID. That's how we became friends. I would, you helped a lot of us get through a lot of that nonsense 5 years ago when Donald Trump was, it's like deja vu. I cannot believe we're back here again. And that we have someone like RFK Jr. Decimating our medical community, decimating our research, decimating the resources and funds for good medical science, to the point now where we have measles going up in unprecedented numbers, which is just outrageous. We have people dying of preventable diseases. And now we have the president of the United States. Oh, they're changing the vaccine schedule, which we knew they were coming for. We'll get to that in a second. I think we should start though with the most immediate thing, which was this disaster of a press conference announcement, whatever you want to call it, rambling mess on Monday, tying Tylenol to autism.
Right.
And the president of the United States literally repeating multiple times not to take Tylenol, and the world community saying, don't listen.
Yeah.
Yeah, it was. I mean, I appreciate that the Kimmel tease, and it's interesting, and for JoJo and Michelle, I was sharing with Tara, and I'm going to say for all your viewers out there, there was actually an article that was published in the New York Times this morning about one of the main scientists, epidemiologists, also the dean of the Harvard faculty, Dr. Bachelia, and they're citing, the White House is citing his research and putting him out there as sort of, here's Exhibit A for why you shouldn't take Tylenol if you're pregnant, and looking at his research, and there's a lot of flaws with the research that he's done, and we can get into that. But I thought, for what I thought was sort of a tragic irony, not sweet irony, is it was revealed that he got paid $150,000. They just broke this morning for basically representing lawsuits, or being on the opposite side of, or the defendant side, when it came to bringing suits against the maker of Tylenol. And so he was getting paid to bring lawsuits, or to support lawsuits against the maker of Tylenol, and paid very handsomely, to the tune of 6 figures. And then this is the person they're bringing in and citing research. And in the same breath, Kaylee Means and RFK's folks, I mean, I've gotten a lot of direct messages on social in response to some of the segments we've done for media recently in the last few days, from folks saying, suggesting those of us actually caring for patients are conflicted and in the pocket of pharmaceutical companies. And yet here we are, and the truth reveals itself that these so-called radical transparency white knights have skeletons in the closet, and that they are being revealed. And so I think I thought that was important to show to the public, because they are doing the playbook on measles, on fluoride in our water, on Tylenol and pregnancy, which we should talk about. It's the same playbook. Let's cherry pick some data that is not the best quality data from years ago. Let's claim that folks like myself and my peers are conflicted and are not doing the right thing for our patients, and then assume this phenotype of being a white knight focused on radical transparency. That's what they do. And they're being called out on it, and they're sort of Exhibit A to defend their whole stance on Tylenol has proven himself to be quite conflicted here. And I thought that was interesting and important.
Yes, because what do we always say? Follow the money, right? We saw this during COVID, right? With the whole, I said it's giving hydroxychloroquine,
right?
Yes,
right.
And bleach up your ass. It's giving that again.
Yeah.
And I just and I'm like, what are we doing here?
The old stock and Clorox and
the crudité TV doc was pushing a non right. He was pushing. Sorry, Dr. Oz. I mean, again, like. Guys, these sentences are Mad Libs, right? Like literally, Dr. Oz.
It's the best. You're the best.
He's pushing, I don't know how to pronounce it, but some FDA not yet approved drug for treating the cerebral folate deficiency.
Yeah,
what's it called?
He definitely is leucovorin, and I should say he has a pretty, as you were citing, he has a pretty robust, also similar conflicts of interest when it comes to supplements.
Yep.
And by the way, we already treat pregnant women. If it's already a recommendation to take folic acid or folate supplementation for the reasons to promote normal brain health. And so there's all these sort of sub headlines here that I'm glad are becoming headlines, because it is showing, I hope, to most of the rational sort of American viewing audience that who's actually protecting their interests versus who's trying to throw the curtains around their eyes. And but I thought today was really important because we've had this back and forth on Tylenol, and it's extreme what it's done and what they've been successful. I hate to say it, they've been successful because they've caused a lot of people to now question, should they do the childhood vaccine series? So we're asking questions. They've caused a lot of expectant moms. I mean, I've heard it. I'm close with a lot of my colleagues at the American College of Obstetricians and Gynecologists. There's a lot of people out there now asking questions and worried when they shouldn't have to be worried. And that's where they've been successful.
Yeah. What do you think that the vaccination rate is in the country right now? Like overall, because I'm hearing, I mean, I live in New York City and I know the private schools in the city are really having a problem. But like public schools, like across the country, what is going on with the MMR vaccine? Because honestly, this is really scary, especially with measles. Measles is so contagious. And I am fearful for my friends and even strangers who have little tiny babies who do not have the protection. And it is really, really dangerous.
Yeah, no, Michelle, I'm glad you brought that up. Yeah, I think it depends on geography, on where we're talking. And so I'm helping to support the West Coast Health Alliance here on the West Coast, sort of a triumvirate states with Hawaii, all up and down the Western seaboard. There's something similar in the Northeast. I'm hoping that we all just consolidate. But, here on the West Coast, it's what you'd expect. And we're at least hitting that 92% benchmark that we need so that the risk of an outbreak is mitigated. And so once you get below 92% vaccination rate for any of these childhood vaccines in a given community, the worry is that one infection or one positive test in a school can then spread like wildfire and become an epidemic. And also the concern in a place like say Florida, where I'd say my polar opposite, Joe Ladapo, is he did something. Well, talk about performative politics. There's Tylenol, there's all these things. There's the MMR vaccine, and then there's what he did a few weeks ago with removing school requirements for vaccines, which was pure performance because they already allow for non-medical exemptions for vaccines, and which are already increasing in a place like Florida. The concern in Florida, Michelle, to answer your question, for all those families out there, they're already flirting with that 92% threshold. And for Tdap, and your viewers might know Tdap as tetanus, diphtheria, pertussis, triumvirate of it's one vaccine protects you against a triumvirate of infections: tetanus, diphtheria, pertussis being the bacteria that causes whooping cough. And that we're already seeing epidemics of whooping cough in a place like Florida, because in some communities that they're in the high 80s, and so they're already past the point where it's sort of the breakthrough potential of an epidemic for pertussis is already very there. So it depends on where you live. And what I worry about more than anything else is, the president, we talk about sort of nonsensical gibberish and what he said on Tylenol. I thought it got even worse when he started talking about, you guys may remember, he started then deviating into MMR and spread out the shots and too much liquid and all
That's
this.
really what it's about.
Yeah, I have a little bit of a
hepatitis B?
supercut. Oh, sorry. Go ahead, JoJo.
So he was talking about hepatitis B as well, and how
Hepatitis. Yep.
Yeah.
I have a little bit of a
That was the
supercut here.
creepiest part.
If you don't mind, I'll play
Please.
this.
Oh yeah, please.
Yeah.
First, effective immediately, the FDA will be notifying physicians that the use of well, let's see how we say that. Acetaminophen. Acetaminophen. Is that okay? No, I'm making these statements from me. I'm not making them from these doctors. When they talk about, different results, different studies, I talk about a lot of common sense. For instance, in cases of extremely high fever, you feel you can't tough it out, you can't do it. I guess there's that. If you can't tough it out, if you can't do it,
Tough it out.
That's what you're going to have to do. You'll take a Tylenol. But hepatitis B is sexually transmitted. There's no reason to give a baby that's almost just born hepatitis B. Wait till the baby is 12 years old and formed. Break it up because it's too much liquid. Too many different things are going into that baby at too big a number. The size of this thing, when you look at it, other things that we recommend, or certainly I do anyway, is see the doctor 4 times or 5 times for a vaccine. Don't let them pump your baby up with the largest pile of stuff you've ever seen in your life going into the delicate little body of a baby. Even if it's 2 years, 3 years, 4 years, you just break it up into, I would say 5, but let's say 4 visits to the doctor instead of 1. The other thing that I can tell you that I'll say that they will maybe say at a little bit later date, but I think when you go for the shot, you do it over a 5-time period or 4 times, but smaller doses, and you spread it out over a period of years. You pump so much stuff into those beautiful little babies, it's a disgrace. I think it's very bad. They're pumping, it looks like they're pumping into a horse. I can tell you that I had a woman who worked for me, a beautiful, wonderful woman working in Trump Tower.
No idea.
Perfect.
Her face
child.
was killing
I
me.
remember this little blonde-haired boy running around the lobby of Trump Tower, so healthy and so vibrant. Great. One day, I came in and she was crying, her eyes out. I said, "Are you okay? What happened?" My boy, I've lost my boy." "What does that mean, your boy?" "My boy, you know him, sir. You've seen him grow up. He was so beautiful. And I took him for a vaccine, sir. Developed this unbelievable, I think she said 107, 108. It goes well beyond when this happens. It goes up to 106, 107, 108 to a level that you never hear about, but it goes up very high. They get fried. Developed an unbelievable temperature. And I saw the boy. It was so tragic to see.
I'm so glad you played that, Michelle, because a lot of us, I didn't see all of that as well. It's just like, it's way kind of worse than
of like a 15-minute situation. Yeah.
Sometimes I'm sorry.
I know people are mad in the comments. Please don't laugh, but I'm like, I have to because it's so ridiculous.
I know.
I sometimes think we're living in like an AI, like I don't know, simulation, because I cannot actually believe we have a doctor here, who knows what he's talking about. But that person who should not be giving it, like tankled, freaking dark-handed, slurry-speeched tan mom,
shoe polish shellacked,
is giving medical advice on his feels, on his his vibes, his feels. Like people will listen to him, right? They will listen.
Yeah, that's the problem.
That's why he said it's coming from me, because he knows the cultists out there will listen to him. And shameless plug, Michelle and I have on Dr. Stephen Hassan tomorrow night on The Stakes at 7:30. So for those who follow us at Seneca, to talk about the cult part of this, and also to talk about the Charlie Kirk Christian Dominionism stuff. But the cult part of this is also why 1 million people unnecessarily died during COVID. Go ahead, Dr. Gupta. What's your reaction?
Your diagnosis of that.
I mean, what struck me first was, Tara, you and I have been having this conversation for a better part of almost 6 years now.
Yes.
Is when sort of version 1 of that was, you had folks like Tony Fauci and Deb Burks.
Yeah.
Jerome
Fauci's a
Adams.
national hero. Deborah Burks needs to, say some Hail Marys for forgiveness, but go ahead.
100%. She definitely, 1000%.
Yeah.
But the phenotype of the individuals that were at the White House podium surrounding the president, the first time he started giving medical advice during COVID, generally looked different. And they were pained, they pushed back, and I'm sure there was a lot of internal disagreement. You have Mehmet Oz, you have Jay Bhattacharya, and you have Marty McCreary surrounding Kennedy and Trump. And why does that matter to all your viewers? None of these people either long ago gave up patient care or have never once stepped foot in a hospital. In the case of Jay Bhattacharya, Marty McCreary, him and I were once collegial, and he has now upset a lot of people in the clinical community who were once his close colleagues, because in 2021, he made a decision to go on Fox News, and I think he did it for reasons of notoriety, and started putting out nonsense information about COVID and the vaccine causing myocarditis more so than the virus itself. And that birthed this whole movement. And that's the reason he's the FDA commissioner, is because Kennedy saw that and picked him up. The reason I'm saying that is everything that the president just said would be objectionable to anybody that's remotely respected and credible as a healer, as somebody you'd want, any JoJo, Michelle, Tara, anybody you'd actually want performing surgery or caring for your loved ones or yourself in a hospital, respected and knows what they're doing. Nobody would also want to permit hearing that, or would want to stand behind somebody and put their reputations on the line hearing that.
It's
and so
unbelievable.
Their accommodation of it, I think, is important to note, because they have picked certain people to accommodate that, to give shelter. Two, I mean, it's just to say it, 4 versus 5. I mean, he's making up this sort of go 5, go to 4. And it's, real time he's making this stuff up. It's obvious he's making it up. 2, he said stuff that, of course, now, X number of million of people are probably going to say the president said it to every point they've made. Therefore, if I or a pediatrician, you name it, were to counter his message, there's going to be a subsegment of people who immediately don't trust what I say, because, I think it's a minority of people, but 20-30% will be like, well, no, the president said don't take Hep B until you're 12, or to spread out MMR across 5 visits, which, by the way, there's only 2 shots. So I don't know how you do that. You give like a fractional shot. And so it's hepatitis B, this notion, I mean, this has been going on in the far right wing community, that I've gotten a ton of DMs on this. Why am I spreading, quote unquote falsehoods about the hepatitis B vaccine? Because, why does a baby need it at birth unless they're having quote unquote sex or getting IV drugs on birth? And, some ridiculous version of that statement has been communicated to me. And then you realize, you're like, wow,
can you just explain it though? Because there may be people who don't understand that it's
100%.
Because it's from the mother, but go ahead.
And the reason we do that, exactly, and I think what's being missed from the president is hepatitis B. Well, it can be absolutely transmitted through sexual intercourse. It could be transmitted through IV drug use, so any sort of mucous membrane or injection drug use. But the reason it's transmitted through injection drug use is because blood is involved, and you're injecting something into a blood vessel. And the reason, in other words, blood is the biggest transmitter. And during birth, the concern is that mom gets screened in many parts of the country at 8 weeks for hepatitis B. There is no guarantee mom will get screened between 8 weeks and birth, in many parts of the country where especially access to maternal care is not robust. And we know there's an equity lens here, that especially in places where those relying on Medicaid or are underinsured, they may get the 8-week screen. They may not even get the 8-week screen, but between 8 weeks and birth, they may get exposed to hepatitis B. Who's to say? It's one of the most sort of common viruses out there. It is very common. And so it is to say that there's a reason why this pathogen is very transmissible. It's very common. We're all exposed to it. And the reason why it's important to guard against, what mom may get exposed to between 8 weeks and birth is because they may not get screened again. And so that's why we say, obviously labor and delivery, there's blood involved. Baby will get exposed to that blood. And because we don't necessarily get a screen, let's just give the birth dose. Let's give a dose of hepatitis B right before baby leaves hospital within the first 24 hours of life. The reason that matters is we tried to do the screen. Let's only give hepatitis B to folks that screen positive. And what we realized, and who screen positive, by the way, at 8 weeks, what we realized is we were missing a lot of moms at birth who got exposed between 8 weeks and birth. Baby got exposed, then unaware. And 90% of babies, for all your listeners out there that get exposed at birth to hepatitis B, develop chronic liver disease, cirrhosis, and that's a fatal diagnosis. So there is this whole sort of let's screen and then vaccinate did not work, because it doesn't work, because our healthcare system has real problems that Kennedy and Trump, I wish, would focus on versus all this nonsense that they're having us deal with. But there's a reason why you want to get your birth dose of hepatitis B, because you want to make sure baby is protected. And we give that blanket recommendation because we tried the whole screen strategy. It turns out a lot of babies got missed, and there's a lot of preventable serious illness as a result. Real quick on MMR, you cannot physically split that dose. It's 2-shot regimen. And we recommend the first dose between 12 and 15 months of age for baby, and then between 4 and 6 years of age for that second dose. They have conflated this nonsense that somehow giving the combination shot of MMR, so measles, mumps, rubella, with varicella, which protects against chickenpox, that you don't want to give that combination shot as the first shot. Between 12 for that first shot, you don't want to give the 4 shot. You want to just give the 3 shot. And again, lots of confusion here. The reason why is there's a very small risk of that 4 shot, MMRV for short, causing something called febrile seizures in a young baby, 12 to 15 months of age. So the recommendation has always been, let's split it, give MMR and give varicella separately. CDC has recommended that for years. The American Academy of Pediatrics has recommended that for years. There has been, because of that very, very small risk. And by the way, all these infections, measles, mumps, rubella, varicella, have a higher risk of causing febrile seizures than the vaccine itself, but never mind that.
Right.
They come in, their ACIP committee last week, the only thing they do that doesn't materially benefit anybody is they say, no, we're going to remove the combination shot as even an option for parents to have as shot 1 for tiny infants. And why does that option matter? For a subsegment of parents out there, they don't have easy access to medical care. Same issue with hepatitis B. And if they don't have a family history of seizures, and if they've gone through sort of an informed process with their pediatrician, it does make sense for 15% of families on average use the combination shot, because their kids hate needles. What kid loves needles? But also access is an issue. And if they don't have a family history of, say, febrile seizures, it could be a safe option. So all they're doing is they're interfering themselves into the doctor-patient relationship, doctor-parent relationship. They're not materially helping anybody, and they've removed this as an option for some segment of families for which this could be thoughtfully considered. Again, it's just a bunch of activity. There's in the name of radical transparency, when in reality, this has already been transparent. We've already discussed the risks and benefits, and we've already recommended to do split shots for that first shot. So it's a lot of activity and a lot of wasted effort for no material gain.
That's the party of small government, though, right? They want to be in your bedroom. They want to decide what books you can read. They want to make the decisions on what medications and shots and vaccinations your children can get. It's terrifying. And by the way, coupled with all of these cuts to Medicare and these closures of hospitals where it's already difficult to get access to healthcare, all of this is just going to get that much worse.
And
but
I'm Medicaid. And cuts to Medicaid, where, and the rural hospitals and clinics that give access to most people, right? Like it's the whole "Make America Healthy Again" is so antithetical to what they actually want to do. You know,
Like-
that's like part of the propaganda that they
Yeah.
do. Same thing with Make America Great Again. I always say they hate everything that makes America great.
Yeah.
They hate everything that makes America actually healthy. They're trying to dismantle this for their own power and their own financial gain, and at the cost of the rest of us. It's so obvious and frustrating.
And with all the lip service about death panels, however many years ago that was, I mean, that's kind of what's happening now, right? I mean, like, people are going to die.
Yeah,
they're dying now, Michelle.
And they're dying here and they're dying abroad because of what we've done and walked away.
Right.
In terms of, and those diseases, by the way, they'll come here too. But
most of them are preventable, Joe. And
Right.
just for people, for what you just said, because it's it was like a throwaway, but true. Nick Kristof did an unbelievable report. He came back from Africa and did a report on what's happening in some of the places where the USAID funds are not going anymore. And he was on CNN. They did I think it was CNN just this week. I don't know if you saw this, Vin, but he was talking about this poor little girl whose village was funded by USAID programs, and her school was funded by them. Their medical care, their mosquito nets, because malaria is such a problem, and that the mosquito net in her home got a hole in it, and she got bitten, got malaria. And she couldn't go to school anymore because the school closed because they don't have the funds. She couldn't go to the clinics anymore because they're gone because of that. They couldn't get new mosquito nets when the holes came in because that funding's gone. And within like 2 months, she was dead from a preventable disease, from malaria, because of this.
God.
That's just one example. He gave another example about a poor young boy who died basically a horrible death of starvation because I don't know what it's called. You may know what it's called, but there's like a packet or something that they give, like a nutritional supplement that they provide. What's it? Do you know what it's called?
I think, is it oral rehydration therapy, or is it
was like something that they give twice a day. It's like a supplement that can bring kids back from malnutrition. It like keeps them alive. And anyway, we stopped sending that over there. And instead, there's warehouses here in the United States that's costing the government $10,000 a day to store this supplement that we don't need here in the US. It's meant for overseas stuff that we're not distributing anymore because they got rid of that program. So kids are dying every day, horrible deaths of starvation, where they could easily be saved from this because of this administration.
At the same time, they're burning contraceptives that they were sending over there. They're spending our tax dollars to burn them, not sell them, not give them to anybody else. Burn them, destroy them. So they're going to have higher birth rates, when now you've got higher birth rates coupled with the missing aid that they were getting. And again, we're going to create, this is all, guys, this will impact America, because we're going to create a bigger refugee crisis, because those people are going to be fleeing and coming somewhere. And then, there's all this compounds on top of itself. But what I wanted to ask about, because it does impact us obviously directly here, is the CDC. You mentioned the CDC.
Yeah.
CDC always felt like this thing, like, oh, it's fine. You don't have to question it. You don't have to worry. But now, I mean, what we just saw with the head of the CDC that they fired because she wouldn't go along with his vaccine schedule. They don't listen to any medical experts over there anymore. It seems like he has completely surrounded himself with loyalists and political appointees who don't know anything about medicine or science,
and quacks.
Yeah. 100%. And I'm close with a few of the leaders that resigned, and I think when you talk to them, what's most chilling, yes, I mean, we've lost expertise that you can't just simply replace. What I worry about is the CDC more than anything else, and they did this in the back well before COVID. They were doing this constantly. General public rarely engaged with it or knew about it, but they're a data collector. They're an institution that collects a bunch of random points of data that are seemingly meaningless to the general public, but it's data on an emerging infections popping up somewhere in the world, or maybe trend rates we were talking about vaccine adoption in a place like Broward County in Florida, and bringing to light trends and being the early warning surveillance system for the country. And when you manipulate that data, and the concern here is that data will be manipulated or not followed at all, at the core of it, CDC manages important epidemiologic and public health data that probably is boring when talking, when talking about it to the American public, but serves a vital function. Because if something's happening somewhere in the world or somewhere locally, you want to stamp it out before it becomes a gigantic problem. And there is no confidence that this CDC, one, will be transparent with the public if there is actually something wrong and share it proactively. And then two, there is a concern that the entire data monitoring apparatus is being destroyed as we speak, as we're losing a lot of good people who don't want to do what Bhattacharya, Macri, and Oz do, which is stand behind and give credibility to what this administration is doing. So people are voluntarily leaving. There's obviously not resources being poured into CDC to do these things. So that to me is the most concerning piece is, it's one thing who's at the podium speaking. That's really important. The messenger is important. But the number two is, what is the institution actually doing versus its core function, which should be looking at this data. And so that's what really worries me.
I have an old friend who's at the CDC, and she is a lifetime servant in public health. She could be working for any big pharma company making all kinds of money, but she's not. And she's still at the CDC, God willing, I don't know how much longer. But, I talk to her frequently about, what's going on. And she's like, they took away the funding and research for childhood drowning. She's like, it's things like this that people don't realize. She's like, we're holding on for dear life over here, trying to preserve anything that we've been doing for the last however many years. And I think where this also comes into the politics, and this is something that she has voiced to me as well. She's like, some crazy person who was listening to all this misinformation put 150 bullets into the windows of our offices.
Yep.
And there was barely a blip out of the White House. And
RFK didn't even bother to go to the funeral or really do anything about the guy that courageously put his life on the line there. But he made sure he went to Charlie Kirk's memorial.
That's right.
Charlie Kirk is the day. Yeah.
Well, since we're talking about it, thank you for raising that, because I think that is one of the saddest things that I get from, people have asked me, will you talk about it more on your platforms? And, to the extent that I can, I will, but I appreciate you bringing that up, because there is the fact that there was an acknowledgement of what happened at CDC, was essentially tacit approval of it happening in the first place. And since you brought up Charlie Kirk, I do want to bring up my friend and former classmate, Melissa Hortman. I went to her and I were classmates together later in life.
Know that.
I didn't know that. I'm sorry.
No. She was deeply respected, and it didn't get lost on any of us, as I know it's not been lost on many people, including the three of you, that there was not bipartisan condemnation for what happened to her and her husband and to the other family. And their dog. And she was already a big time leader. And then to see appropriate bipartisan condemnation for Kirk, 100%, that's what it should have been. But it was so over-indexed with Kirk, and it was so under-indexed with Melissa. And I just, there's certain things I wish we could, were unimpeachable, one of which is reactions to those types of tragedies. And then two, more to sort of,
it used to be.
And then apropos of this conversation, I will say, and this is why I so deeply appreciate what all three of you are doing, because you're allowing us to have this conversation and reaching more people, which I really appreciate, and I hope we can keep doing this. I feel like there has to be a reckoning in medicine, because Kaylee Means and RFK and Ladapo, they have a lot of power because they're really good at marketing, and they have no constraints because there's no accountability. The institutions of medicine have no ability to hold them to account when it comes to what they're doing. So it falls on us in civil society to try to do it, but we can't mimic their platform that they currently have. We can hope to replace them, I hope. But so I worry about accountability in medicine, because what's ironic to me, and by the way, you guys should usher me off stage whenever I know I'm well past sort of the time that you guys are sharing, but let me know when you guys got to go. I think what I worry about is the very institutions that you want working. I think whether you're a Democrat or you're a Republican, whether you're a MAGA or whether you supported Vice President Harris, I think we all want a surgeon, a trauma surgeon who has been credentialed by all the institutions and knows what they're doing from all the institutions in medicine. If your family, let's say you're in a car accident, God forbid, or if your family member is, you want a doctor who knows what they're doing. If you're in an ICU, I'm triple board certified. I feel like I know what I'm doing. My patients trust me. And I've been credentialed by all the places that you want. You want that for your loved one or for yourself if you need help. What I find interesting is that those very same institutions, these caricatures of healthcare leaders are saying, don't trust us when it comes to Tylenol and pregnancy. Don't trust us when it comes to MMRV and hepatitis B. But, oh, by the way, hey, if we need to get a surgery, trust us. Or if we need to be in an intensive care unit, trust us. It's okay in that case, but no, throw mud on us elsewhere.
Or question if you have a Black surgeon or a woman that they're not qualified to do. Like, listen to the Charlie Kirks of the world who dropped out of community college and became a MAGA mouthpiece. Oh, that he is the one that thinks that, oh, well, Black women don't have the brain power to be Supreme Court justices, or he doesn't want to have his appendix taken out if it's a Black lesbian doctor. But, they want people to be more traditional and have names like Chad. Like, you're supposed to listen to those people.
Oh yeah. I've seen a lot of that signaling too.
Outrageous.
Yeah. It's just the paradox here and the inherent contradictions, but all to say, whatever the future looks like, there's going to have to be a reckoning here. Mm-hmm. And I hope that means some measure of accountability, and Congress could do that. Should they have the will to do that. But somebody's got to step into this, because it's only going to, we've seen this now with fluoride. We've seen the COVID mRNA technology, which, by the way, is not just for COVID, it's for lung cancer. I'm a pulmonologist. mRNA technology and its use cases for lung cancer treatment are incredibly promising. What do? They ended the funding for it. Fluoride, hepatitis B, it's going to keep happening. And we can keep doing this, and I think people benefit from it, because 80% of Americans believe in childhood vaccine requirements. I do not think the majority of Americans have voted for this or want this. But at what point will we start to have accountability measures and hold them to account, so that the ways in which we are held to account to our patients, we are always do no harm, make sure you're doing the right thing, and if something bad happens, there are accountability measures in place to keep doctors in line, as they should be. Mm-hmm. But what about healthcare leaders in the public discourse? The same sort of guardrails that exist for us in the four walls of a hospital should apply to a healthcare leader, or quote unquote leader in this case, that has a podium. And it doesn't. And that feels deeply ironic, and it's just a contradiction. We should hold everybody to the same standard, regardless of how they're operating in the healththare field.
Yeah, we have a doctor in the Senate who confirmed RFK.
Yeah,
that's
right? Yeah.
Crazy.
Shame on him.
Speaking of accountability. Yeah, I'm worried about the chaos that comes. That's what I'm honestly like. I think about, those movies like, Outbreak and stuff, where you see that insanity. We've all lived through a pandemic now, right? We had this madman at the helm, but he did have those guardrails at the time in Fauci, et cetera, right? But that's all gone, and the undergirding that existed then, that was established by people like Obama, is largely gone. And then so I worry about some kind of crazy outbreak, right, of any one of these diseases, or one we don't yet know, and the chaos that ensues, and the death of expertise coupled with that. Like, I just wonder if, this is a political question and you don't have to answer it, but like, it does feel like it's by design, right? Like, that's how it feels to me.
I know. I'm happy to answer it. No, and I think you're right. I some people believe, and I don't know if I disagree, but I'm an eternal optimist, and I'm hopeful that I'm going to keep trying. those that are in the medical field that are less optimistic than me think that we're going to have a catastrophe worse than COVID that is going to be almost necessary to reset our mindset when it comes to who to trust and who not to trust. I hope we don't get there, but there's certain people that think that that's going to happen. You're right, because Jojo, you're right. We've lost a lot of expertise. And then Cassidy, since you brought him up, I have to say,
shame on him.
As a physician out there, and I guess in my case, public advocacy and information and media, I tell people, I didn't move from New York to Seattle, Washington, thinking this would be a major role for me, but I take it very seriously, especially now.
Thank God for you.
Well, thank you for all of you for the trust. But what Cassidy is doing now is a stain on the U.S. Senate and also on his profession. And he's lost I think this matters to him when he goes to bed at night. He's lost the respect of his peers. Doesn't say it, but behind the scenes, he wants the respect of his peers, and everybody does. And what he is doing on Twitter, I saw it. You probably saw this too, all three of you. He's sitting there after the Tylenol announcement, asking for radical, pushing back on it. After the MMR announcement, pushing back on it. It's anemic. It's really weak. It makes him look terrible.
Yep.
Because he could actually do something about it, but he still chooses not to.
It's his fault. We have this. He could have stopped it. Like, we didn't have to be there. Just like, Joni Ernst and Pete Hegseth. We didn't have to have him. Like, we didn't have to be here now. Or like the other jerk-offs that approved Kash Patel as the FBI director. Like we didn't have to be here. And then you guys want to turn around and like clutch pearls and be like, well, we didn't know. You promised us. Like, you guys, the enablers are worse than these people. I've said this for years because they were in positions to stop this and didn't, because they were cowards or they wanted money.
And like, these aren't the first people to lie during their confirmation hearing. I mean, like, come on. There's talk about accountability. There's never accountability. And like, the word accountability, I think is great. But for me, like, I want justice. I want justice at the end of this, because there just seems to be time and time again, no one ever has to pay a consequence for what they do, whether it be the financial crisis, whether it be COVID, whether it be any of these things, or January 6th, we just hand the keys of the castle back to the people who did it. And I'm tired of it. As an American, as a human being, I'm tired of watching this happen. And sorry, go ahead, Tara.
No, Julie, who's not with us today, Julie Roginsky, who's our other co-host, she would say that there needs to be there need to be trials. Like Nuremberg style trials at the end of this for, to as a reckoning for all of the destruction by these people willfully in this country. I feel like if she were here, she would bring that up again, and she's not wrong, because there has to be some kind of accountability.
Yeah.
I mean, we're a country that handed the keys, to your point, Michelle, back to the person who went golfing when refrigerator trucks were being filled up with the bodies of our fellow citizens. When he was interviewed by Jonathan Swan, he said after 1,000 Americans were dying a day, he said it is what it is. And the country handed the keys back to him. He doesn't care. He said he didn't accept responsibility. He doesn't care about a health crisis. He doesn't care about our children being vulnerable. He doesn't care about maternal mortality rates. He doesn't care. And that fish is rotting from the head down. And because there's never been true reckoning, true accountability for any of that, it's metastasized now. That's me using like almost a medical term. It's metastasized into the body politic. That this is now that senators like Cassidy can look at RFK and see every ounce of data that points to the fact that he would do just what he is doing right now, and say, but you pinky swear you won't be yourself. You pinky swear, leopard, that you'll change your spots. Oh no, the leopard didn't change its spots. Why didn't the leopard change its spots? I will tweet now. This is. I still I come back to it, but I hope that it doesn't take some kind of outbreak, contagion to take
again.
Like they're talking
again,
about
though, Joe. We thought COVID would have done it, but we thought the insurrection would have done it, and look at where we are.
And I think it's because there's too much distance. And Dr. Gupta, I know I said this when you came on the stakes with us. It's like, as a New Yorker, somebody who was living in my tiny ass little apartment while my neighbors died one by one, there were so few trusted voices in the media, in leadership, in government that we could listen to and trust, and you were one of them. And I'm so appreciative of that, because let me just tell you, I know I'm not saying anything new to the three of you. You do not want to live in the epicenter of a plague. You don't want, like, and that's sometimes what I wonder. I'm like, do you have to be in the middle of it and watch the people around you die and wonder about your own safety and your own life, and you can't go out and check your mail without risking your life? I mean, because the rest of the country kind of, it slowed down. There was a flattening of the curve, and so people didn't have that kind of immediate danger of the flames kind of flickering in their face. And I wonder if maybe that's part of it. And it shouldn't be, because we should be able to see the suffering and the death and destruction of our fellow Americans and take stock and learn something from that. But, you know, unfortunately, the rest of the country, a lot of the country saw, oh, well, I can't go to the bars, and, you know, I don't want to deal with this, and I'm inconvenienced. So, you know, it became more of just like a pain point and grievance than anything else. And the unfortunate
mask, right? The politicization of wearing a mask. Like, I never understood that part of it, which is so asinine. So if you want a doctor to wear a mask when they're doing surgery on you, because you want to keep away germs and infection, why would you not wear a mask to protect you and your fellow citizens from an airborne disease?
Yeah.
Like,
but
it
now they
was so stupid.
But now they want to wear masks all the time.
Right. To disappear people and deny them of their process. So, Dr. Gupta, you know, I think that we always try to do this because it's always so doom and gloom. Give some people some hope, because in the comments, there are lots of folks who also feel the way Michelle and all of us do, thanking you for your public advocacy and your service all these years, because thank God for folks like you. But where are the trusted voices that people can go to now in lieu of, since we can't trust the government? You know, what should people do going into flu season and stuff like that, as everyone's worried about losing access to things that we all used to have, like the vaccines and things that were readily available to us? People are very confused. They don't know what to do. So I think those two things, kind of giving some advice to folks who are worried about, you know, where do we go? Who do we listen to besides you? Who else out there? And what should we do as they're heading into flu season about getting vaccines, even for measles and things like that? If you're older, I'm 50 years old now, which I'm in denial about. So they're you know, I get hit.
You look great, Tara.
Thank you. But AARP apparently thinks I should be a member, which is bullshit. Okay. Aside about this, my husband and I were having dinner yesterday, and we saw the clip of Jimmy Kimmel with Norman Lear saying, "I miss this guy on a day like today." And so then they showed, of course, like all in the Family and all of that, Norman Lear's legacies. And I was like, Marcel said, "You do understand we're older than Carol O'Connor was when he played Archie."
Oh, yeah.
I said, "Shut up." And we asked Alexa, how old was Carol O'Connor when he played Archie Bunker? And she said 47.
Get out.
And I said, no, I can't do it.
Old was old then. It's not old anymore.
47? Anyway, so I say all this to say that for folks like me that are now, they're saying you should get shingles vaccinations, you should get this or that. So we're over 50. We're like literally now in the category of people older than the pharma commercials that play, like 43. I'm like, I can't. Anyway, so give us some hope, Vin, please.
Yeah, I'll do my best. I think on the hope side, and I say this just for your audience, that there has been, it may not feel this way, and I understand that, but there is the medical community and with governors, some governors across the country are galvanized in a way that I think is important as we enter the midterms, and then before long, hopefully there's continued elections in 28. And it's important for people to know that, because I'm working very closely with the American Academy of Pediatrics as one of their surrogates, and I'm on the board of the American Lung Association, all nonprofits. Unlike what RFK says, none of these entities are bankrolled by pharmaceutical companies. These are nonprofit medical organizations representing frontline clinicians that you want caring for your loved ones. And what's happened, from a hope standpoint, is they're no longer, I've previously felt that medical organizations tend to be pretty anemic and not forceful and not direct in their messaging because they're worried about upsetting somebody. And those days are over because they now understand that if we continue to do that playbook, we're facing a very different threat here with RFK, his minions on the internet, and how they communicate, and that we have to do something similar.
Yeah.
So the hopeful piece here is, I think about medical societies and being very close to a few of them, being their surrogate. They're willing to talk about different things in different terms and tones and to directly take on RFK and his nonsense, which is good. One, I think that's a trust builder, and it's important as we think about the future and how we communicate about policy, what candidates we support, and who should be in these appointed positions based on the outcome of an election. Two, there's a lot of movement in purple and blue states, at least, mobilizing the medical community in combination with political leadership to say enough is enough. We're not going to listen to anything coming out of CDC or ACIP for the next few years. So, West Coast Health Alliance was formed on the West Coast, model for the rest of the country, but the Northeast has its version of it. So I think I worry about too many of these coalitions being built up. But the hopeful part is at least this has risen to a priority level where the Gavin Newsoms of the world and the Bob Fergusons and the Josh Shapiros are saying, okay, health is no longer sort of, public health and health messaging. There's 20 other priorities. Now it's rising to the very top. And I think that's important and hopeful because when you have political attention, you get capital, you get resources, and people pay attention. And so there's a lot of movement here that I know might seem like it's getting snuffed out because RFK has a megaphone, but we're trying, and I'm hopeful about that. When it comes to resources, there is no better and more scalable way for people to counter and get their questions answered. It's hard to do it on mainstream media. It's very easy to put nonsense out on social. I think these engagements are critical, but there's no replacing a pregnant woman talking to her obstetrician about, say, Tylenol, because now I'm hearing people that previously used it for pregnancy-related pain or fevers now feel guilted to not use it. And shame on the administration for making an expectant mom feel that way when there's no reason to make an expectant mom feel that way. And the way to reassure is not me, a man, telling somebody on TV, oh, take it. No, it's okay that they're lying to you. Have the conversation with the obstetrician. And I think a broader call to action is, Tara, 40% of American adults between 35 and 54 years of age do not have a primary care doctor. We have a broader problem here when it comes to medical engagement. I get it. Nobody wants to see a doctor unless they're sick. Nobody wants to be in a clinic because who wants to be in a clinic? But if you get your preventive screenings, get your blood pressure checked once a year, really important from 18 years of age on up. There's other things I'd love for people to do. I just got a coronary calcium CT scan to look at the arteries around your heart.
We just our doctor just told my husband and I, well, you're 50 now, you should go get one. Oh, we're like
100%.
But you're right.
It's important to get. If your insurance doesn't cover it, it is $100 out of pocket. In many cases, insurance will cover it, but you don't even know about it unless you establish care with a primary care doctor, which 40% of adults don't do, which is why it's really easy for Kaylee Means and RFK to do the things they do, because millions of Americans have no touch point with a doctor and haven't built up, or a medical provider, and haven't built an off-ramp away from this nonsense to have these conversations. But, so for those out there looking for digital resources, I'm a big believer in healthychildren.org. It's produced by the American Academy of Pediatrics, complete nonprofit. There's no financial incentive at all. They update it. It's easily navigable about vaccine recommendations. Immunize.org for adults. So if you're turning 50 and you have questions about which shingles vaccine to get, that's the right questions to ask. Immunize.org is great. Because now you also should be thinking about maybe Pneumovax and any number of things. I won't bore you guys with the whole immunization. Immunize.org, so without the D.
Sorry.
Immunize. Oh no, perfect. And then healthychildren.org.
Okay.
But those are two digital resources that are trusted. There's no nonsense. There's no There isn't what happened with the Harvard dean getting paid $150K to bring lawsuits against Tylenol. There's none of that. And it's just straight medical information that's easily navigable.
What about stat news? What, like for news, is that a good resource?
I like Stat. The one thing I don't like about Stat is that it's behind a paywall.
Oh, it is now.
And so some of their stuff that I'd love to read is just paywall. So if you're able to afford it, great option. We're all just one individuals, of course, but I'm really proud of the work that we're trying to do across mediums, putting good information out there. And so I on my Blue Sky account, Vin Gupta at Vin Gupta MD at Blue Sky, I am constantly trying to put information out there. And to the extent that people find it useful, there's always going to be resources like that. But obviously people have their own preferences when it comes to individuals that they may not know personally.
Sure.
But I think there's some people out there trying to do the right thing. And I just really appreciate the three of you. You could have any doctor on your show, and so the fact that you choose me means a lot to me.
Oh, Dr. Gupta, you know how we feel about you. And no, it's really the privilege is ours, because you are, like you said, you are a working doctor. You still see patients. You are in emergency rooms and ICU units, and on top of all of the other public health advocacy work that you do. So the fact that you would spend an hour with us today on a Wednesday is really, the privilege is ours. We're humbled by it. We're grateful for you. And everybody, please, if you're not following Dr. Gupta, please, I joke and say he's my Gupta, because a lot of people know Dr. Gupta from CNN. So when my mom and I are talking, I'm like, it's my Gupta, not the CNN Gupta. But we absolutely adore you. We're grateful for you. God bless you and your work and what you're doing with your colleagues. And you're welcome back anytime. And when there's some good news, please come and tell us.
I will. Thank you for that. Yes, thank you for that. Thank you.
Thank you so much, Vin.
Thank you so much. Bye.
We all love. He's our Gupta.
He's great. He's fantastic.
I mean,
I just want to. Oh, sorry. Go ahead.
No, go ahead, Michelle.
No, I just wanted to add on. I didn't want to take up too much time in the conversation. To also urge people to get the HPV vaccine. Little boys and little girls, it matters. You can now. They've changed the threshold. I think you can be up to 45 years old now. And while they do say that it's, most effective if you get it before you're sexually active, there still can be some protection or some other, benefit to that. And I say that as I've been watching the Instagram account of a friend of mine who had recurring cervical cancer. She's my age. I think she's actually a couple years younger than me. She had an abnormal pap smear, which then just usually those things kind of clear themselves up, but hers didn't. And it kept getting worse and worse. She has now had to have a full hysterectomy. She's had to have all of her organs, digestional stuff. She has 2 stomas, 2 ostomy bags now at the age of 40.
Oh my gosh. So and could this have been prevented if she had the HPV vaccination? Is that the
Yes. And she's a very vocal advocate of vaccinating your children against the HPV vaccine. And, the HPV vaccine doesn't just protect against cervical cancer. It's vaginal cancers. I hate to go there, but I'm just going to do anal cancers, throat cancers, all different kinds of cancers that can be spread in different ways. And so this vaccine this is why hopefully cervical cancer will be a thing of the past someday. And so I watch my friend go through this, and it's really heartbreaking. I mean, to think that people are not offering this to their kids. So,
or being told misinformation to dissuade them from taking something that's medically available and preventative.
Yeah.
And I think that was kind of like the main, I have to say that I have had the honor of being friends with Dr. Gupta for many years now, like 5 or 6 years. That is the most solemn I've ever seen him.
Yeah.
He's always very calm and measured, and that's just part of his. That's why he's so good on TV and like very easily digestible in the way he presents things.
Yeah,
and I will say that is by far the most down or solemn I've ever seen him. That's how you know it's a 5-alarm fire in the medical community, because he's so well plugged in, and you see, all of his credentials and who he knows and the things that people he works with. So that says a lot to me about the state of affairs only 9 months into this fucking nightmare. Sorry, his dad.
The thing that I keep thinking about, I keep coming back to this, is that is back during COVID, when it was like the people who wouldn't get the vaccine because they wanted to own the libs, and then they died.
Yeah.
Like the thing is, these diseases don't care how you
No.
vote. They don't care who you like as a president. They don't care about anything related to your politics. They will come for you just the same as they will me or anybody else.
That's
so
right.
For people to think that, like, cry harder, libs, because pregnant women, and by the way, when I was pregnant, particularly with my son, I was terrified of everything. I didn't know what I could do, what I couldn't do. I was so scared once I had swollen ankles that I was like, something was wrong. And I, went to my doctor at the time, who was like, you're overreacting. And I was like, I've never been pregnant before. I don't know. So when you're pregnant, you're in a kind of hyper anxious state just to begin with, right? Because this is your baby. This is this thing that you want. And everything you put in your body, you're like, oh my God, how is this going to impact me, them, etc., mostly them. But like, it's a crazy time, and so reliable information is crucial. And I did change doctors, actually, because I didn't feel like my doctor met my concern with the legitimate.
You were listened. You were being listened to. Like, ask lots of Black women who go through this all the time, or like, the Black mortality rate for women, childbearing is awful, because doctors don't seem to listen to Black women the same, which is just crazy. And people are like, you're overreacting. That you might have saw the story. It happened in Jersey. It happens, unfortunately, everywhere. But a couple of years ago, there was a story about a woman. This had nothing to do with economics. Okay. This was a upper middle class Black family. They lived, I think, in Livingston in Jersey. And if you're from Jersey, that's a moneyed area. And she started having, complications, and went into the emergency room. They weren't listening to her. It was almost like the same thing with Serena Williams, right? With the preeclampsia stuff, and like all these things started happening. And she was a perfectly healthy, like late 30s woman, and she ended up dying because in giving birth, because the doctors did not listen to her and listen to what she was saying her symptoms were. And this was in New Jersey, in a moneyed area, upper middle class Black family. And now this father, the husband, no longer has his wife, and their son doesn't have a mother because of that bullshit. So it happens all the time, where doctors don't listen to women.
Yeah.
It's unfortunate. So
nothing was more telling to me than the documentary with Serena Williams, who's one of the most famous athletes in the world, going in to give birth to her child, and being ignored about the pain and the symptoms that she was feeling, and she could have died.
She almost did. Like,
it was pulmonary embolism or something, right?
Yeah. So,
how many mothers miscarrying now? We've seen so much data in places like Georgia and Texas, etc., where in Texas, where Abbott is particularly evil, and he had that ban in place even before the trigger laws, where women going in miscarrying, and because there's still a fetal heartbeat, they have been forced to die of sepsis, etc.,
or criminalized for having a miscarriage at all. I mean, there was recently a woman who miscarried in the state of Texas, I believe, and she was like arrested, and of course the headline doesn't tell the story, right? The headline's like, woman arrested for mishandling the remains of a baby or something, and I'm like,
infant, I think they use the term too, which is very inflammatory.
Which is super inflammatory. And like, again, like all of this is like, let's really get down to it, is about, if you read about, or if you listen to people out of the evangelical or even Mormon or the trad wife world, is that they are anti giving women any sort of pain medication, epidurals, anything like this to make childbirth, not excruciating or for any other reason. And
because they're supposed to tough it out, Michelle.
Yeah.
Tough it out.
That's what the guy who cried about being in a cold courtroom said.
Right. That's what Captain Bone Spurs complained about.
Like, this man has ever been part of childbirth. Like, this man has ever been to one of his kids' doctor's appointments. He doesn't know. He doesn't give a shit.
No.
And this is, at the end of the day, it's about controlling women's bodies. It's about making it harder. It's about trapping women in their pain. It's about criminalizing pregnancy. Because when they run out of reasons and they run out of variables that they can blame, birth defects or any other sort of disease or autism or anything like this that happens to small children, they will blame the women. They will blame the women. And then they wonder why women don't want to have children.
Right. Did you see the stat recently? They I think CNN, Harry Enton did it. I really enjoy him. He's a trip, that guy. But he really puts up some good data oftentimes in the mornings on CNN. It was in the last week or so. They showed, it was last week, because it was about kind of like the whole dynamic with Charlie Kirk and families and like the roles and all of that was kind of introduced into the conversation. And that Gen Z's attitude about having children, right? Men versus women.
Yes.
And how many children they think is an appropriate number of children to have for the family, and like how the gap is like this, to what men think and what women think about having more than 2 children or more than 3 children. And women are like, I don't think so. And men are like, yeah, that's great. And then like how many women actually don't feel as though that they need to, like, it was like, there was another thing about, do you feel you need to have children or like to have a fulfilling life or something?
Yeah.
And for women, that number is way down. And for men, it's way up. And this is a coming cultural problem. And you wonder why.
Listen,
you have so many
also a
problems here.
Situation too, right? They're saying that the health, happiness, and well-being of married men is the complete opposite of married women. Married women usually have more stress, more work, more, just overall angst, when like marriage really is a lot more beneficial to men. And it just like, that's just the structure of how heterosexual relationships have been for many, many, many years, if not centuries. And, but again, this is like this, talk about a reckoning. I mean, this is again a reckoning to the gender roles in our society. And it's like what we need to be doing to keep each other happy in order if we even want these relationships.
Well, Charlie Kirk said, shut up, don't get your degree, go have more babies, get younger and have more babies, because that's really what women are only worth.
Meanwhile, he married a woman with several degrees, by the way, who was the CEO of her own company. And I believe in her 30s when he married her, which he also told us was past her prime. So that's the other thing. All of this hypocrisy. Right.
Yeah, she's older than
5 years older than him.
Yes. Yeah. All of this hypocrisy. And Melania Trump's profile picture is her at the desk because she wants everyone to know she make executive decision, okay? because she's a homemaker, right?
Yes.
Right.
Yeah.
And listen.
Hypocrisy.
Yeah.
I know that we have a hard out because Michelle has a
a couple minutes.
I just want to make sure that we do talk some Jimmy Kimmel, because it's we started off the show with that, and all of us I think did everybody get to see? Did you watch Kimmel last night, Joe?
I fell asleep.
Oh, that's okay.
Sorry, but I watched all the clips today, so I've seen quite a bit of it. I did, and I've seen him get very emotional, and it made me very emotional as well. But so I didn't watch it as it aired. It's on here because we don't have Sinclair, but I think the closest Sinclair market is you.
Yeah. So I took a screenshot because I have a program that allows me to watch local TV stations all over the country. So I was able to do it on my iPad. So I was sitting there with my iPad. I took the screenshot, and Rafi and I were watching because Marcel, my husband, was long gone sleeping. He had to get up early for work today, as I shared on the group chat. But so Rafi and I were up watching, and I don't usually watch late night because I'm usually either watching cable news because I'm nuts or like doing something else because that's just not me. But damn sure bet I was watching Jimmy Kimmel last night. And I watched it on the New York station because I also wanted to see New York commercials. So I've been seeing a bunch of the gubernatorial commercials and the mayoral commercials happening in New York, which is in New Jersey, which is a whole nother conversation. But I thought that Jimmy Kimmel knocked it out of the park.
Yeah.
I mean,
he took the high road every possible direction.
He did.
And
without sacrificing being like defiant also.
Yes.
Like, he was like, listen, and he was visibly emotional. He cracked up a bunch of times throughout the whole thing. He started to like you could see he really meant it. It wasn't performative. But then he also gave it to them straight. And I thought that was really a pitch perfect, tonally perfect comeback for him. Go ahead, Michelle.
No, I do have a few clips here. I honestly don't know what I'm about to, because I pulled them off that chat that we're all on. I just want to play a couple here, just in case anybody missed it.
I am a tiny part of the corporation. They welcomed me back on the air, and I thank them for that. Because I know that unfortunately, and I think unjustly, this puts them at risk. The President of the United States made it very clear he wants to see me and the hundreds of people who work here fired from our jobs. Our leader celebrates Americans losing their livelihoods because he can't take a joke. He tried his best to cancel me. Instead, he forced millions of people to watch the show. That backfired bigly. He might have to release the Epstein files to distract us from this now.
Right, that was great. That was great.
This show is not important. What is important is that we get to live in a country that allows us to have a show like this.
And just one more.
From late night hosts in other countries, from Ireland and from Germany. The guy in Germany offered me a job. Can you imagine?
I think he said something like, "How authoritarian do we have to be for
right?
Right.
That's right. That's right.
He was visibly emotional and audibly emotional, saying he's like, "I would never ever make a joke about the death or the murder of a young man." And I really believe that he believed and felt that. And then he talked about Erica Kirk forgiving the young man who took her husband's life. And both of those moments actually, they got me a little bit, because I think that at the end of the day, like the joke that he was making was never about Charlie Kirk.
It wasn't.
No. It was about Donald Trump not giving a shit about Charlie Kirk, the person who he pretended to say, "Oh, that he's like a son to me."
That's right.
And that was what the joke was about. About his lack of compassion and empathy, which Jimmy Kimmel, I think, showed us last night that, that's how he does business, is through his heart and as a person. And he actually gave a shout out to Ted Cruz too.
That was funny too.
Who was calling me?
That was very funny, because for those who don't know, Ted Cruz went on his podcast and basically said that, hey, I hate everything that Jimmy Kimmel says, but I respect his right to say it. And if they're going to come for him, they could come for us one day. And you saw a lot of that in conservative circles. That's right. Yeah. I mean, we were joking the other day, like, oh my God, we're actually agreeing with Tucker Carlson. The day we agreed with Tucker Carlson, Nick Fuentes, Ted Cruz, and Joe Rogan, Jesus.
Yeah.
Candace Owens. I mean, on the steps of the Capitol provider, I was like, what on earth? But it does show, though, that like when somebody says something that makes sense and it's true and it's something we all benefit from, have the humility to be able to say that.
Yeah. I mean,
I wish that it translated to other voices being silenced, because I mean their entire anti-DEI agenda right now is about silencing the already marginalized. So like, it's a comedian, a white comedian, that they're like, oh no, we must ride in, we must ride in and be the heroes of free speech right now. And it's like, well, okay, I'll take this, but so this is the moment. But what I believe in, what I think a lot of people could agree on, is we will take our wins where we can get them. And for me, this one felt like a very needed reminder that we, the people, are still in charge, and we, the people, are still stronger than the people in power. We brought the House of Mouse to their knees, a company that has a very mixed past of being very supportive of our rights and diversity, etc. This was felt very out of character in many ways for a company that I have, when Tara and I had a long conversation about this, that I've loved since I was this big. Me too. But this one was a reminder that I needed, that we still have the reins of power. Don't let anybody tell you otherwise, because this is a win.
Yep. Absolutely. We were cautiously like, wait, is it a win or not? Like, what is Jimmy going to say? But then I was like, you know what? No, it's a win, regardless of, him getting back on air, short of him actually finding out that he gave money to Turning Point.
Oh, God.
Which was not the case.
No.
It was a win. And the fact that Disney capitulated, and basically, I mean, whether it was because of economic reasons or whether it was because, the shareholders were looking at the stock going down and people canceling their Disney Plus accounts, whether it was, and Jim Acosta made a good point about this. I was on MSNBC talking about this last night before Kimmel went on. But like Jim Acosta did a great rant about, we're not going to go see the movie with Baby Yoda now. Like, people are going to not do this anymore, because we're like, fuck you, Disney. And as painful as I was saying, I'm like, even for me as a huge Marvel and Star Wars fan, I'm like, don't do this. Don't make me do this. Please don't make me do this.
How I feel about only murders in the building. I was like, I was like, the only thing that brings me joy.
Yeah. So I was like, please don't make us do this. But I didn't realize that this was another thing, right? I mean, capitalism still is king. Okay. And whether they did it for the right reasons or for the money reasons, they still did it. And capitalism is driven by the people.
Yeah.
On top of that. And that's why, even for independent media, it's why we do what we do here. That's why all of us have dedicated ourselves to alternative ways of getting information out, because we cannot rely on the corporate overlords anymore, because they're in the tank. They are in the tank. And as long as they have to rely on Donald Trump and his administration, like Nexstar, the affiliate that the station owners that didn't air Kimmel, or Sinclair, who ideologically is aligned with MAGA. So it's not even a money issue for them. It's ideological. And they turn this into a holy war type of thing, which is another whole layer of this that makes it more precarious, because they don't even use the Constitution as the guide. It's the Bible and their holy war stuff. So that's a whole different type of enemy that we need to fight. But we still, as the people, still put pressure. And it was the peers in Hollywood that put pressure on Disney, that said, we're not going to work with you anymore if you do this. It's, it's the, oh, by the way, the trailer dropped yesterday for the Mandalorian movie. And I was like, oh, that was another thing. I'm sure all the bean counters in Disney World, Disney, land, not the real one, but like corporate Disney, we're going, listen, guys, we're going to lose billions of dollars, because there are more people than these crazy wackos that want to boycott us. There's way more, because there's only 20%, by the way, which when I saw that number, I said that also explains why Disney said we're going to do it anyway. It's only 20% of stations that did not carry Jimmy Kimmel last night. So it was the 80-20 thing. We'll take the 80, fuck the 20.
And I want to just show this last thing before we go. Is Donald Trump did, of course, have to respond. He truthed out last night. This was about an hour before Jimmy Kimmel went on air. He said, I can't believe ABC fake news gave Jimmy Kimmel his job back. The White House was told by ABC that his show was canceled. Something happened between then and now, because his audience is gone and his talent was never there. Why would they want someone back who does so poorly, who's not funny, and who puts the network in jeopardy by playing 99% positive Democrat garbage? He is yet another arm of the DNC, and to the best of my knowledge, that would be a major illegal campaign contribution. I think we're going to test ABC out on this. Let's see how we do. Last time I went after them, they gave me $16 million. This one seems even more lucrative. A true bunch of losers. Let Jimmy Kimmel rot in, and I don't know, because there's a banner there, rot in his bad ratings. Great. Cool.
So much wrong with that.
So many things are wrong with that, right? But remember, that this is the same fucker who said, I had nothing to do with Jimmy Kimmel being canceled. He was canceled because of a business decision. It was his ratings. And then they bring him back and he's like, you better cancel him or I will personally come after you. And by the way, ABC, great job with that $16 million settlement, because we all know how many times we talk about obeying in advance. That's when you do that. When you give the bully your lunch or whatever, the bully is going to come back. They're going to keep
more.
Back for more every single fucking time. How many times do they have to show you who they are before you believe them?
Right. This is this is a microcosm of all the other problems with him. It's like what is a failed coup, but a training exercise for the next one. It's like over and over and over and over again.
Yeah.
Like people do not learn. They will not learn until they do, and then hopefully it's not too late at that point. But it's not really feeling all that
hopeful. Until they pay enough of a price, and we're trying to avoid that. Okay.
Sorry, go ahead, Tara.
No, finish.
ABC just showed the way to everybody, to you, Harvard,
Disney,
to you,
Disney. That came down from Disney.
You're right. Yep. Disney just showed the way, and to everybody else out there, every institution, every university, every law firm, every media network. You don't have to bend the knee. You don't have to capitulate. You're all free market people. You all love capitalism. Let the markets decide. Well, the markets decided.
Yes.
And we, the people, decided.
That's
right. So you do not need to obey in advance. It's actually better off for you if you don't. Just fucking tell the bully to fuck off.
In the words of Donald Trump, just don't do it.
Just don't do it. Vladimir, stop.
I just want to say this. I want to say this about the acetaminophen thing. So because it was like honestly beyond parody that he could not pronounce acetaminophen, Abby, my 12-year-old, can pronounce acetaminophen. I tweeted about him not being able to pronounce it, and I Googled acetaminophen to make sure I had the spelling right. So it was a capital A, and all the trolls were like, "Oh, she had to Google it to see how to spell it, but Donald Trump can mispronounce it." It's like, I was trying to make sure I had it right. That motherfucker couldn't even say it, and he was telling people not to take it.
Right.
The trolls
we're supposed to listen to you, telling us not to do something you can't even pronounce. You fucking imbecile.
I know. Guys, I gotta drop out because
we're going.
We're going to the next thing, but
I'm gonna go right about escalator gate because
I love it. I love it.
Yeah.
Everybody, thank you so much. Thank you to Dr. Vin Gupta for joining us today. Thank you to the two of you. And Julie, we missed you. But we'll see you all back here on Saturday at 10 a.m. minus JoJo, who's in Soccer Mom world until the rest of time. And we'll see all the rest of you on Saturday, tomorrow night, Thursday on the Stakes with Tara and I over at Seneca Project. Go read JoJo's Substack. Are you effing kidding me? And go subscribe to the Siren. Everybody else, we'll see you later. Bye.
Subscribe to Mayday.
Bye.
Subscribe to Mayday.
Bye.